Good afternoon. My name is Michael Grady, and this is another episode of Local Expert Interview. I'd like to welcome today Dr. Bral of Jersey City, New Jersey. Dr. Bral believes in healthy smiles and confident well-being go hand in hand. Maintaining a beautiful smile is more than just regular brushing, but requires periodic professional care to keep a beautiful smile. Welcome, Dr. Bral.
Thank you. Glad to be here.
Dr. Bral, please tell our viewers a little about yourself and your practice.
Well, I've been practicing as a general dentist in Jersey City for close to 17 years. About seven years ago, we moved to our new location that is renovated. We are very happy about it. But what I'm most proud of is our staff. Our patients tell us that they are very courteous, friendly, and helpful, and that's the way that we like it, and it's like a team that we are approaching the patient care.
I see. What are some of the services that your office provides your patients?
Well, we provide all phases of dentistry under one roof. We do implants, we do braces, we do extractions, we do fillings, dentures, you name it, probably we do it. One thing that is important to us is to respect the patient's time. I know that today everybody is very busy. We have working moms that come here to treat for treatment for themselves or for their family member. I know my wife is very busy, and what we do is that we provide all phases of dentistry here for them. So basically the same visit that mommy comes to get Johnny's braces tightened, he might need also a cleaning, and she might also need the deep cleaning that she wanted to do for a while, so they can do everything on the same visit instead of making several appointments with different specialties to go to take care of their dental needs.
That sounds great. You know, in our talks, I understand that tooth extraction is one of the procedures that you're really known for. So can you talk to our viewers a little bit about your tooth extraction process?
Sure. There is a belief in the surgical community that a small cut heals the same as the large cut. A cut, they mean raising a flap. That means raising a gum away to see what's under this to do the work. What that belief ignores is the fact that the discomfort during the time of healing is a lot more with a big flap, with a big cut, than with a small cut. What we have done in our office is developed a technique over the years that we don't need to raise a flap. We don't need to cut the gum at all to go ahead and reach even the hard to reach tooth pieces under the gum. We can do that without raising the gum. We can go ahead and remove it, and we find that it is it's a lot more comfortable to the patient for the healing. Even if the patient gets general anesthesia, that only helps during the extraction. But after the extraction, they still need to cope with the healing process that might take a few days. So during that time, if you don't raise the gum, if you don't raise the flap, I think that the comfort level is a lot higher. Another technique that we use, we have developed, is that basically if anybody had any extractions, they know that there is commonly a feeling of push and pull that they feel on their jaw while the tooth is being extracted. What we have done, we have developed a technique that we can remove the tooth without much of a pull and push being discerned by the patient. So basically, it is very gratifying to me to see that after I'm done, I tell the patient, oh, well, you're done, you're finished. And they are just sitting there waiting for the push and pull to come, and never came. And the surprise look on their face is nice to see. They sometimes get up to see the tooth on the tray to say, oh yeah, the tooth is up, and that is something that we like to do. And basically, that's what I aspire to. I'd like to be able to bring that to our patients.
That is fantastic that you're always looking to minimize the amount of discomfort for your patients. And I understand that you're also known for cosmetic dentistry overall. Could you tell our viewers a little about that?
Sure. Well, aside from bonding, that is a part of cosmetic dentistry. Cosmetic dentistry entails fabricating and cementing different prostheses on the teeth. These prostheses may be a veneer, a crown, or an onlay. So basically, it is very important that these prostheses fit well over the teeth. The patient should know, and not so many people do know that, but the patient should know to ask the dentist how he would check for the fit of the prosthesis over the tooth. If the answer is, well, we use an explorer, we go with an explorer over the margins to make sure that there is no gap between them, I don't think that's good enough answer. Because there are teeth next to them, and you cannot really feel you cannot really discern any opening in the proximal areas between the teeth. Also, if they tell you, well, we use a very good laboratory that we don't even have to check, that's also not true, because machines are not precise that much that you can just rely on them completely. What we do in our office is that we have developed a technique too that we can see how the fit of the prosthesis is before we cement it. We are going to see if there are open margins that might cause any decay under the prosthesis, or they might cause gum disease. Basically, if we know that in advance, if there is any chance for that, we are going to take the precautions so that a year, 2 years down the road, the patient would not have any problems with the prosthesis. Another thing that we do with our technique is that we find out if there are any pressure points under the prosthesis, between the prosthesis and the tooth. These pressure points over time cause fracture on the prosthesis, on a crown or a veneer. So basically, if we know that in advance where they are, then we can relieve these pressure points so to ensure the long-term, a long life for the prosthesis. So basically, the prosthesis is going to be healthy and it's going to last a whole lot longer. So these are some of the things that we do for our patients, and I believe that they should ask any dentist that they go to.
And that brings up an interesting point. And as a premier dentist in the greater New Jersey area, in your opinion, what's the most important thing that anyone should look for in a dental practice?
Well, the things that are important, in my opinion, first of all, is that the dentist should have a very keen focus on preventing pain and discomfort for the patients. That's probably on the top of the list. The other thing is to assure quality control. Quality control is very important. Basically, to relegate that to the lab technician that doesn't see the patient, that's not right. In general, what we do in our office, we make sure that we check everything. We make sure before we give it to the patient, everything's seated, everything is according to our standards. Before we say that, okay, this is good, and we tell the patient, well, this is what we have for you. The other thing that helps in this today's busy lifestyle is convenient appointments. We also try to, as I said, since we have under one roof, we have different modalities of treatment. We can meet the needs of working mothers, working fathers that need to take care of the dental needs of themselves as well as the children's, and basically be able to go on and do the errands, the other errands that they have.
I see. It sounds like your practice is very accommodating to your existing patients, but I know you also do some very special things for new patients to help them out. Can you talk to us a little bit about new patients that come to your practice?
Sure. I wanted to mention that we appreciate the business of appreciate the relationship that we have with our existing patients, and we welcome the new patients to our extended family. We have specials going on a usual basis. Right now we have specials on our braces. The braces we have are basically we can set it up as a payment plan that would cost a fraction sometimes of what other places would cost. We have implants that are very, very reasonable at this time. We also have a kit for denture with 4 implants that basically once it saves them hundreds of dollars. We have various other discount plans too that helps a lot of people. We have payment plans which helps many people too. Also, we really like treatment plan, talking about the different options that the patient has. That's why basically it's not a burden to us that we need to charge for it. We have a free consultation because we like to talk to our patient about the different options that they have. There is no charge for it. They be more than welcome to come. I'd be very happy to talk to them about any concerns that they have and talk to them about the different options that they have, and it's up to them to choose which way to go.
That is really fantastic, Dr. Bral. I would like to thank you for coming on this interview. You've given us a lot of great information about the processes and procedures, cosmetic dentistry, and of course the most important things for any dental practice. Dr. Bral, please, thank you very much for coming on this interview.
Thank you very much. Glad to be here. I appreciate it.
This has been another episode of Local Expert Interviews. If anyone would like to contact Dr. Bral, please refer to the phone number at the bottom of the screen. Again, thank you, Dr. Bral.
Thank you.